Hello Dimensions class, this is Leah with your final live lecture for the quarter. And with this live lecture, I'm just going to focus on some review for the final exam and just to go over a few details. I know I've put some clarifying comments out there in my posts and things like that, my announcements, but yes, it is cumulative. Also, it is open book, so that means you can bring in any notes. If you have the concept guide that you made notes on, you can bring that in. You can bring in your book. If you have an ebook or your book electronically, you can open that up in a separate window or a separate device. So it's still important to know the content so that you're not spending too much time looking things up, but definitely those are all options. Also, there will be a hidden password in the middle of my live lecture here today, and that's what I will have you put into Dropbox for the live lecture in order to get full credit. So please do stay tuned for that. Today I'm just going to hit on some topics that we may or may not have talked about already, and then some things that maybe were a little, seemed a little bit more of a struggle on previous tests that we've done. So I'll just apologize in advance. I do have a little bit of a cold, so hopefully I can get through this without too much of a coughing fit because I've been having some of those. So one of the things that is something that you all will see a lot in your nursing career and hear a lot of talk about is quality assurance. That's not necessarily something that we talked about in healthcare 20 years ago. We're in a very different time. So we are always looking to see that we are doing things correctly and looking for ways to improve. So making sure that we do have quality assurance in all that we do. So an example of that would be recently at the institution where I work, we were having a lot of catheter-associated UTI infections, or UTIs, it's called CAUTIs. So we had our rep from the company that we buy our Foley catheters come in and do some kind of re-education, some observation, some re-education, and then some teach back with showing on a mannequin how to correctly place that. Because some nurses have been out of school for a long time and may have been taught a different way than what's currently best practice and may have, strayed away from what's best practice in their years of working clinically. So that would be one type of quality assurance measure that could be done in the hospital setting. Also talking about the Institute of Medicine, and that is something that's only been around about 20, maybe 30 years, and that is, they focus on quality and how they define that quality. It speaks very much to health services for individuals and also populations, and that will help to increase health outcomes. So how do we make our whole population healthier? They first started publishing reports in 2000, and with their first data poll that they did, they found that about 98,000 deaths happened within our healthcare systems that were preventable. So I think that was an eye-opener for a lot of people because prior to that, the IOM had not been publishing reports. Something to think about in nursing, and I believe I may have touched on this before, is really lateral violence in the workplace, bullying. Those are things that we talk about with social media and teenagers, but it's crazy to think that it actually follows us into our professional careers as well. So just to be cognizant of that, and as a new nurse, always make sure that you're standing up for yourself and you have a solid mentor who you can go to if you have questions and concerns. That is very important. If you do have conflict and you do need to deal with that, always make sure that you give feedback at the time and definitely try to resolve those issues in the moment to help flush that out. You don't want to harbor that and then bring that negativity, internalize that and bring that back to your patients. That certainly is not good. Remembering to look back a little bit from our first few modules, speaking specifically of Florence Nightingale, the founder of modern nursing, looking back on things that happened in our country that helped to shape nursing education, such as World War II and the high demand for nurses. So making sure that you do touch on some of those things. Also, speaking specifically of case management in the acute care setting, in the hospital setting, what do they do? And some of you, if you're working in a hospital already as a CNA or an LPN, you can probably speak very well to that. But if not, just familiarizing yourself on how the case manager, which a case manager can be an RN or a social worker, and how they really follow that patient throughout the different phases of their hospital stay. So from the very moment that the patient arrives, case manager is already planning for discharge. So is that discharge home? Is it to a nursing home? Is it to assisted living or short-term therapy in a nursing home as well? So basically they're overseeing that care and helping guide them through various parts of their stay as well. As we talk back or think back to the first few modules and really thinking back to theory and theorists, and what's the difference between a theory and a model? They are different. So theories aren't always proven. We're trying to prove a theory, and typically a theory is something that you might think, I bet, or I wonder if, but it's not quite proven yet. A model is a representation of something that actually does exist, and we know that it does. Also knowing that a case manager can also act as an advocate on behalf of their patients and help to be that voice and helping to link everything with their care, whether that be with the physician or pastoral care or the pharmacist. That case manager can try to tie everything together. What do we know about evidence-based practice? Again, that's something that's become huge in the last 20, 30 years. We always want to look at what best practice is and look at the evidence for that and have that be the guiding force with our nursing care that we give. When we talk about people who do bully in the workplace and that lateral violence, it's typically because they have lower self-esteem and they're people who are not comfortable or do not feel as competent as others. So they feel that it's better to put other people down to help make them feel higher, more superior. Just go ahead and rebrief yourself on HIPAA, confidentiality, what that means. Can we talk about a patient's care in an elevator? No. If we are talking about a patient care, at times it's completely appropriate if it's people who are on the patient's team of caregivers, but you still need to be really careful the environment in which you're talking. That's very important as well. As you progress throughout your nursing career, your critical thinking skills will be very much honed in. You use reasoning that you can pull in from theory, from books, things that you've learned in school. You can also pull in other clinical scenarios that you've been in, and putting that all together really is critical thinking. And also knowing that as you go along, you may start to develop intuition. It's that little sense of, oh wow, you can just see your patient's appearance. You have those little visual, verbal cues, and you go to hang that second unit of blood, and there's a little spidey sense inside you saying, I think this patient might be going into fluid overload. That's that intuition where you have that feeling and you can start to like preemptively think about things. And some of you already working in healthcare may already have some of that, just because you can kind of start to see different patient trends and how patients present and that sort of thing. We also can work within our framework as nurses when we utilize results of testing, maybe lab results or whatever that might be, our opinion, and then decisions that we make. That all of that together is clinical judgment. There are times where you have to make clinical judgment calls, so be familiar with that as well. If you are involved in a situation, and this happens, where something goes awry, not as planned, that would be a significant event in your facility, and you probably will have, there's different software systems out there, but we call it like an incident report back in the day. Now, like I said, there's different computerized software systems that you can fill it out all electronically. But also remembering that when there is a serious, if there's a death or a serious physical injury, loss of limbs or function of an organ or something like that, then that truly is called a sentinel event. Because there's lots of little things that can happen here or there, risk type things, but a sentinel event is the big one. When something, somebody loses their life, or a wrong laterality, say a surgical procedure or something like that, that's pretty major. So understanding how that gets reviewed and what we do with those types of things. Important for you as an RN or working towards your RN to have a good idea of delegation and what that means. What can you delegate? Can you delegate a nursing assessment? Can you delegate someone to pass PO meds or give an IV push medication for you? Those are things that you need to have a good understanding of. So you always need to know what you want to delegate and who you want to delegate it to, and is that something that they're competent in doing? Because many times you need to make sure that the delegation is appropriate. So depending where you practice, it's, you know, say you're working with an LPN, depending on where you practice, sometimes they've gotten extra training on IVs and that type of thing, so they can do some of those things. But typically not. Also, you know, an LPN would not be able to write up a nursing diagnosis, you know, nursing care plan, that sort of thing, because that's utilizing those RN assessment skills. So just to be comfortable with all of that as well. When you are working in the hospital setting, make sure that you, and I know I always talk about this a lot when I'm teaching in the sim lab, but make sure that you have a good understanding of what SBAR report off is, or you know, what that stands for, because that's really best practice right now for a reporting tool or reporting technique. So it's your situation, your background, your assessment, and then your recommendation. So that's, if you're calling a physician, if you need new orders on something, they are familiar with taking your questions via SBAR, and then it keeps your conversation nice and concise, and gives them the information that they need to give you the next set of orders or whatever that might be. There are many different types of nursing. There's lots of options, lots of opportunities to do many different things once you graduate. There are even types of forensic nursing. I know, you know, I think like when CSI came out, like everybody wanted to go into forensics. Just very popular. So really the only, I shouldn't say the only, but one type of, and I know this because I lead a team of SANE nurses, sexual assault nurse examiners, and they do get special training in forensic nursing because they are actually taking samples that have to be sent off to the state crime labs. So just to know about that. The code word is going to be Christmas. Just drop that in there for you all to put in the Dropbox, and make sure that you have an understanding of Medicare, you know, Medicare versus Medicaid. I know that can be a little bit confusing. And also, I know we already talked a little bit about, you know, nursing theories versus models. So have an understanding of what really makes up a theory. What are the 4 components that are vital to having a nursing theory? Make sure you review a little bit on DNR orders and who can write those, and how those are enacted. I think that's it. I think you guys are all going to do well. I touched on some of the major topics, but overall there will be some types of questions that are similar to questions you've seen in the first 2 exams. And please let me know if you have any questions. I will be posting this, and then like I said, please go ahead and put the code word in the Dropbox, and I'm wishing everybody a happy holiday, and thanks for listening.